Imagine waking up with severe chest pain, but knowing you can't afford to see a doctor. Would you risk your health or would you risk financial hardship? For many Americans, this isn't a hypothetical scenario. This is reality. Today, my purpose is to persuade you to give some time to donate or volunteer for the National Association of Free and Charitable Clinics, or NAFC. I am credible to speak on this topic after doing extensive research. Some points I will cover are the needs of the organization, a solution to fill the needs, and the consequences if we fail to volunteer. To begin, I will discuss the needs of the organization. The first need is money. According to West Health, inability to pay for health care reaches record high in U.S. by Tiffany Yu. About 35%, or 91 million Americans, are not able to afford quality health care that is needed. According to the NAFC funding, the NAFC has managed 35 grant program cycles with a total funding of 25 million to free and charitable clinics, charitable pharmacies, and state associations. Money is an important aspect to the NAFC to give quality care, but the organization also needs volunteers, which brings me to my second point. According to AARP, National Association of Free and Charitable Clinics, the organization depends on volunteers, whether they are medical or non-medical. They strengthen the organization and fill in the cracks of the healthcare system. Volunteering can help many Americans with medical issues that they can't afford. For example, according to Independent Sector, free and charitable health clinics put the net in safety net. We know there are so many people across the United States who fall through the cracks of our healthcare system, Lemereau says. They don't make enough, and there's no other way to say that, and they don't qualify for Medicaid. There are also people who have Medicaid, but who don't have access to dental care, mental health care, or prescription access. Like funding, volunteering is an incredibly important part of the NAFC, which leads to the increasing need to access to healthcare. This brings me to my last point. According to grant makers in health, elevating quality to achieve equity in free and charitable clinics, the work of Roadmap to Healthcare Quality Equity. The program includes more than 75 clinic partners nationwide and has been collecting data since 2020. Although the NAFC has many clinic partners, there are still cities in the U.S. or in the United States where people don't have the opportunity to get the help they need. Keeping the needs of the organization in mind, putting them into action can change and make beneficial impacts to the healthcare system. If putting these needs into action, it can help the organization help more Americans that struggle to afford health care. By increasing the funding, recruiting more volunteers, and raising awareness to these services, the NAFC can continue expanding access to quality health care for those who need it the most. Supporting this organization can improve health outcomes and strengthen communities across the country. You can become a volunteer by taking the following steps: finding a local free or charity clinic, contacting the clinic directly, choosing a volunteer role, whether medical or non-medical, completing the clinic's volunteer requirements, and begin serving your community. Now that we understand how to volunteer for this organization, let's consider if we do not volunteer for the NAFC, sickness rates could get higher, death rates could also increase, and the opportunity for the millions of Americans that cannot afford health care would be lower. This could add stress on families that need the medical care the most. And if you choose to volunteer, more patients will be able to be seen, more families can be helped, and the people that need the health care will get the treatment they need. And here is a graph. Oh, it's backwards. Well, the graph says it's the impact, according to the impact highlights Illinois free and charitable clinics. There were 49,745 patients served. The federal poverty level is 100%. And the providers, about 175,000 hours of volunteer time was donated, and an estimated value of $5,903,848. The services that are offered are 96,020 primary care, 99,000 plus prescriptions and vaccinations, 19,216 visits for oral health, 16,874 visits for behavioral health, and 19,806 specialty visits. In conclusion, today I have spoken about the importance of funding volunteering and increase access to healthcare, a solution to fill the needs of the organization, and the consequences if we fail to volunteer or donate. Hopefully I have persuaded you to volunteer or donate to the National Association of Free and Charitable Clinics. To begin, call 703-647-7427 and start volunteering at your local clinic today.